Hey, good evening. This is Dr. Burzeen Karanjawala. I'm with Sacramento Colon and Rectal Surgery Medical Group. And today I want to talk with you about anal abscess or perirectal abscess and anal fistula. Abscesses in this area are, kind of go hand in hand with anal fistulas. So let's talk about both and what they are. So an abscess in general is just a pocket of pus. It's an area of infection in a part of your body. And specifically an anal abscess or a perirectal abscess is something near the anus or the rectum that has an infection. Typically these infections start within the anal canal in one of the anal glands. One of these gets infected and that infection burrows its way out, and then you develop a boil or a swelling outside of your anus, and that's when you notice it. It becomes painful. You may have a fever, you may have chills. It's very uncomfortable. It may pop and you may notice a lot of pus and blood drain out. And of course, when it pops, that leads to a lot of relief. A lot of times patients come to us and it hasn't popped yet. And that's something that we're able to treat in the office. If it's a very large abscess or it's something that's very deep, sometimes we have to take patients to the operating room in order to take care of it. An anal fistula is essentially a tunnel or a tract that goes from inside the anus or rectum, and it goes out to the skin. So a lot of patients will complain of noticing a lot of drainage from the area, or they may come to us with a history saying that they've had an abscess multiple times in this area and it just keeps coming back in the same spot. When we hear that, we're very suspicious that there's an underlying fistula. And that fistula, the reason it causes infections is because stool and bacteria are passing through it and sometimes can get stuck underneath the skin and infect that area and cause that pocket of pus to form. Who is at risk for this? There's really no specific causes of this in the general population. Most people it happens to, it's just by chance. It's not a cleanliness issue. It's not an issue with not cleaning well. Some people have other issues. Maybe they had trauma to the area that can lead to this. Some people who have Crohn's disease or ulcerative colitis, they can also develop this as a manifestation of their disease. In terms of treating this, some people will think that antibiotics are needed. Antibiotics can be helpful as an adjunct, but surgery is the main treatment. You have to drain out the infection. Once you do that, everything will heal and the infection will clear. In some patients, especially diabetics, we'll prescribe antibiotics as well. But otherwise, antibiotics aren't necessary, and antibiotics alone won't treat this. Now, what to do if, say, you were to have an abscess and it were to drain? Well, most people, once that's done, they won't have any issue. But about half the time, patients will develop a fistula, and they'll either get the recurrent abscess or they'll have persistent drainage. And that's something that we need to take care of so that they don't keep getting those infections or they don't keep having the drainage. So how do we treat fistulas? There's different ways. When we find the fistula, if say we're draining an abscess, we'll usually put a special drain in there, what we call a ceton. And what that allows is for the tract to stay open so that the bacteria can keep going through and not infect the tissue. And then after that, we would do a surgery. Typically we do what's called a fistulotomy, where we go in and we actually cut out the tract and leave the wound open. Over time, the wound heals from the inside out, and after a few weeks, everything is healed and the patients are feeling much better, and the chance of the fistula or abscess coming back is very low, usually less than 10%, even less than 5% in some cases. There are also other treatment options. Sometimes we can take a flap of tissue and cover up the hole to that tract on the inside, what we call an advancement flap. That way, stool and bacteria don't go through the tract, and the tract will just scar up. Other procedures that we do is what's called the ligation of the intersphincteric fistula tract. And what we do is we find the part of the fistula tract that's going through the sphincter muscle, and we go ahead and cut it there and tie it off. That way everything's disconnected and the tract will just scar up. There are also other procedures that can be done, but they're not always as successful, specifically putting a synthetic plug within the tract to allow for healing and growth of normal tissue in there, but that only works about 50% of the time. So if you think that you have an abscess, please give us a call, or if you think that you may have a fistula, come in to see us and we'd be happy to help take care of this problem for you.